evening and welcome to the big story on NDTV Profit. I am Nupur Talwar Suri. Now, 2 weeks ago, the Central Drug Standard Control Organization released a list of 53 drugs which failed the quality test. The regulator also released a list of pharmaceutical manufacturing units spread across 8 states where these raids were conducted. Some of the medicines that were found to be of substandard quality included paracetamol, vitamin supplements, high blood pressure medication, common antibiotics. In fact, the list is endless. This is not a new problem, but this is for the first time that the authorities have cracked down on so many units. The NDTV network decided to pay a visit to some of these units to find out more.
Pantomed, paracetamol, antibiotics like amoxicillin, vitamin C and vitamin D3 tablets, adrenaline injections. These are some of the medicines which have failed the drug test. NDTV reporters traveled to some of these manufacturing units in different states to try and find out more. First off, Haridwar. Our reporter visited Pure and Cure Healthcare's manufacturing unit, which allegedly manufactured spurious Shelcal 500 tablets. Pure and Cure Healthcare is still making these medicines to this day. There's a common sentiment that these companies should not be spared and proper action should be taken against them.
ऐसी कंपनियों को किसी प्रकार बख्शा ना जाए और इन पर कठोर से कठोर कार्रवाई होनी चाहिए, क्योंकि ये जिंदगी से खिलवाड़ करना व्यक्ति का। और मैं तो कहता हूँ उन डॉक्टरों को, क्योंकि वो आज की तारीख में एमआर आता है और दवाई, उसमें आप देखें कितनी बड़ी बड़ी कंपनियां हैं, एल्केन कंपनी है और भी अन्य कंपनियां इसके अंदर है जिसकी दवाइयों सैंपल फेल हुए। और ये बड़ा दुर्भाग्यपूर्ण है देश के अंदर कि ऐसी कंपनियों को लाइसेंस दे रखा है।
Next stop was Mascot Health Series, which is also in Haridwar, whose quality head and director Jitendra denied any wrongdoing.
हमारी दवाई में उन्होंने लिखा है कि डिस्क्रिप्शन में फेल है. It may be happen due to improper storage condition at the destination. अगर कहीं दवाई का स्टोरेज कंडीशन पर्टिकुलर स्टेप का नहीं मिलेगा तो ये उसके कारण हो सकता हो, लेकिन हमारे कंट्रोल सैंपल हमने चेक किया तो कोई प्रॉब्लम नहीं है.
Pharmaceutical giants often outsource the manufacturing of their medicines to smaller vendors and contractors across the country. This is usually where contaminants creep in. All this simply for a higher profit margin.
बहुत सी दवाइयाँ ऐसी जैसे आपका ब्लड प्रेशर, शुगर, इनकी दवाइयाँ बहुत रेगुलरली ली जाती है. इनके पेशेंट जो है वो बिना दवाई के बिल्कुल भी नहीं चल सकते. तो ऐसे में दवाइयों के मापदंड के ऊपर खरा ना उतरना ये बहुत ही दुर्भाग्य का विषय है.
The pharmaceutical industry, however, denies the allegations.
सर, जो लिस्ट या अलर्ट जो CDSCO ने जारी किया है उसमें नकली दवाई के नाम पे सिर्फ 5 कंपनियां हैं, 5 प्रोडक्ट हैं जो गवर्नमेंट ने नकली डिक्लेयर किए हैं. बाकी दवाई NSQ हैं, नॉट ऑफ स्टैंडर्ड क्वालिटी. उसमें हरिद्वार की 5 कंपनियां हैं और उन सभी दवाओं में ज़्यादातर बहुत माइनर डिफेक्ट हैं.
जहाँ तक हरिद्वार की बात करें तो हरिद्वार में 200 कंपनियां ऐसी हैं जो दवा निर्माता के रूप में काम करती हैं, जिसमें से 5 कंपनियों को CDSCO ने चिन्हित किया गया है. उन पांचों की पांचों कंपनियों में दवा निर्माण कार्य अभी भी लगातार जारी है. अब देखना होगा CDSCO की कार्रवाई सिर्फ कागजों में सिमट कर रह जाती है या कुछ गुणवत्ता के मानकों पर असर दिखाती है. हरिद्वार से राहुल कुमार, NDTV.
All right, so the 3 big questions that we are asking today are: question number 1, how do we stop spurious drugs from entering the market? Question number 2, who should be held responsible for the patient's safety? And question number 3, what measures can be taken to ensure quality control of these drugs? Well, to answer some of these questions, we are now joined by Dinesh Thakur. He's a public health activist, founder of the Thakur Foundation. Good evening, Mr. Thakur.
Good evening. Can you hear me?
Yes, Mr. Thakur. Mr. Thakur, now the latest CDSCO raids have raised grave concerns about several common drug formulations that unsuspecting Indians consume. Now, what do you make of the findings and how do we stop these spurious drugs from entering the market in the first place?
Well, this is not the first time that you've had drugs not of standard quality. Remember, I've heard one of your reporters talking about spurious drugs. The definition of a not of standard quality drug in India is different than the definition of a spurious drug. The list that the CDSCO has put out this time with 53 medicines that failed testing, a large majority of those are not standard quality drugs. Spurious has a very different connotation. So let's just be straight about the definitions first. The question here is that this is not the first time that we found out that a large number of these drugs are failing testing by state and central drug laboratories. What is different this time is under pressure from people like me and others who have been asking for the names of these manufacturers to be released. The CDSCO has actually put out the names. In the past, all it used to do was tell us through a similar notification which medicines have failed without telling us who the manufacturers of those medicines were. The reason you're seeing the outrage that you see right now is because this list actually has names of very large companies. Your reporting here, it included visits to smaller and medium-sized manufacturers who's probably not very visible among the consumption of medicines in India. If you look at that list, that contains a number of very large companies which are household names. The question you're asking is that how do these medicines enter into the drug supply? The reason these medicines enter into drug supply is because the state drug regulators who are responsible for licensing manufacturing facilities like the one that you showed me a few minutes ago, they are the ones who are giving these people licenses. The question is, on what basis are these licenses given? You've interviewed managers and officers of these facilities, the manufacturing facilities. The question that one needs to ask is that what is the criteria based on which the state drug regulators of Himachal and Uttarakhand are giving these companies license to manufacture these drugs? Because in our research and what we've documented extensively in our book, The Truth Will, a lot of these facilities don't even have basic equipment, standards, training to be able to manage the manufacturing of these drugs. So you'll have to understand, you have to ask the state drug controllers, what is the basis on which you're providing manufacturing licenses to these companies? The second question you asked, and correct me if I'm wrong, is that how do we stop these companies from making these kind of drugs? Last year, the government passed Jan Vishwas Bill, which is now the Jan Vishwas Act. In July of this year, the government actually published in the Gazette the proposed rules operationalizing the Jan Vishwas Act. And in that rule, what the government is doing, which I had written about extensively last year, is basically compounding the offense of making substandard drugs. What that means is that they're giving immunity from prosecution.
Right, I wanted to come to that part specifically. Do you think, and you've just talked about it, part of the problem that is there in India is that we never affix blame. We conduct these regulatory, we look at the regulation, the regulator goes there, does an exercise of finding that there are substandard drugs, the list gets published, there's a hue and cry about it. But after that, there is a relatively very little follow-up, and the people who are behind these substandard drugs never actually see any sort of conclusive punishment. It rarely goes into the judiciary at all.
Well, so the data actually is different. The data is that the drug inspectors do diligently file prosecutions with the district courts and civil magistrates. Unfortunately, how the judicial system works in India. Even in cases where, after great diligence, the drug inspector establishes that the manufacturer and the officers of the manufacturers are culpable, the judge basically hands a sentence of 20,000 rupees of fine. Despite the fact that in the past, prior to Jan Vishwas, we really had the ability of the judicial magistrates to impose penal punishments, but they never did that. That's the first issue. If you do not provide deterrence, if you do not penalize people who put lives at risk by making substandard drugs, and this has been going on not for the last 5 or 10 years, it's been going on for 75 years right now. The question here is that how do you prevent people from making this kind of mistakes again? Because the judiciary essentially sort of gives these people a pass. The second question is that lay people like you and me and my family in India, we don't raise our voice when these things happen. This is the first time that you're seeing the kind of outrage that you see. Go back just a couple of years ago, during COVID. You've seen the kind of medicine that was sold under scaremongering. Medicines like favipiravir, medicine like ivermectin, which had nothing to do with what a cure for COVID was. And these companies made crores and crores of rupees. There is no accounting for that. And so, yes, I mean, the drug inspectors go out and do inspections, but they do not tell us what they actually find. I've never seen an inspection report written by a drug inspector, other than what we had gotten in an RTI Act from Karnataka, of what the central drug inspector does when it actually goes and inspects these facilities. All we get to know is that this facility was found to be flaunting in terms of compliance. Why is the inspection record a state secret? In the United States, when inspectors from the US FDA come and inspect facilities in India in 30 days, they publish the inspection report. People like me get to know what was wrong with that particular facility. Why doesn't a drug regulator actually publish these reports? Why is that a state secret? You're asking me who's accountable. The accountability rests with the Ministry of Health and the drug regulator, which essentially is captured by the pharmaceutical industry in India.
Right now, India, of course, is also known as the pharmacy of the world. Now, when reports like this one come out, it obviously does a huge amount of reputational damage to our attempts to continue manufacturing drugs. Of course, a few years ago, there were reports that came out that suggested that spurious drugs were sold by India to other African countries. There was a hue and cry about it. But that kind of reputational damage is something that India cannot afford at this juncture when we are hoping to take a leap forward.
What would you like me to say? I mean, you've made a statement. I agree with you. What would you like me to say?
I would like you to tell us, how do we go forward with dealing with this problem if we want to keep still be the pharmacy of the world and produce drugs that are of international quality?
We do produce drugs of international quality. The medicine that is exported to the United States and Europe complies with the standards that are applicable in these countries. It's not that we do not know how to make drugs of good quality. We absolutely do that. I live in the United States, and 80% of our drug supply is generic. And the medicine that I take is manufactured in India. It is not that we do not know how to make good quality drugs. We absolutely do. The question here is that why do we have dual track manufacturing where we follow one standard when we make medicine for export to the United States and Europe, and a completely different standard when we make drugs sold in India or export to Africa? The reason that happens is because our regulations are incompetent. Our regulators are incompetent, our regulations are ineffective. And the judicial system does not hold wrongdoers to account. That's as simple as that.
All right. So what is the way forward? Do we need more policy to come in? Do you think that the regulator needs to be made more accountable?
The first thing we need to do is take bills like Jan Vishwas Bill Act back. Because if you're providing immunity from prosecution to these people who are making medicine that could potentially kill you, what message are you sending to the industry? What are you telling them? You're telling them that it's okay for you to make bad quality drugs that kill people and get away by paying a paltry fine of 20,000 rupees. Is that the message that you want to send? Why don't we start there? Why don't we take that bill back, right? And introduce something that is more accountable, where if you find medicines of this nature that are actually failing the state and central drug testing laboratories, you file prosecutions against these people and make them accountable in the court. Let them come out and tell us specifically why are they taking shortcuts when these companies, the bigger ones, I'm not talking about the ones that you showed here in this program, but the bigger ones, why is it that they follow different standards when they make medicine for export to the United States and don't follow the same standard when they make medicine for consumption in India with our population? Why don't you ask them, why don't the ministry or the regulator, the courts, ask them to come on record and explain this to us, the lay people of the country?
Right, all right. Thank you very much, Mr. Dinesh Thakur, for joining us on the broadcast. So you are, of course, talking about the fact that there is a problem with the regulator and with us following up with action. Thank you for joining us on The Big Story.
You're welcome.
All right. Prosenjit Datta, a senior journalist who has written about how substandard drugs carry a huge economic cost, is also joining us on The Big Story. Hi, Prosenjit. Thank you very much for taking out the time to speak to us. To begin with, now the CDSCO came out with a list of about 50 drugs. But apart from that, there have been several instances in the past where we've exported medicines abroad and questions have been raised about their quality. Now, how do you see this constant battle that we have to face with substandard and low quality drugs?
Yeah, thanks for inviting me, Nupur. Essentially, the problem is very simple. See, when we export drugs to the US or any other developed country, their regulators make sure that the manufacturing facilities which are manufacturing which are making the generics that go there are of high quality and follow good manufacturing practices. Whereas when we export to smaller countries, quite often nobody is checking the quality of the drugs that are going. If we are exporting to countries in Africa, neither the Indian regulator is checking that whether all those drugs are of the high quality that need to be exported, and those countries obviously have lax regulators too. So what happens is that particularly in the last 2 years, there have been a number of cases where our cough syrups have proved to be, have killed many children. Our drugs have been substandard and have been rejected if they have been checked. So this is a grave danger to the pharmaceutical industry's reputation as a whole, especially since we are one of probably the largest manufacturer of generics in the world today.
Right, absolutely. So obviously there is two parts of this. There is the regulation part of it, and the other side of it is following it up with action. Now, often these raids are conducted and we don't see enough action in the aftermath to A, reassure the public that this is an issue that is constantly being dealt with, and B, to send out that message.
See, the policymakers and the regulators need to take this far more seriously than they are doing now. For example, even if somebody is caught supplying substandard drugs, generally he or she gets away with a slap on the wrist, nothing more. The maximum fine they may pay after 6 months or 8 years, several years of litigation would be barely 20,000 rupees or 30,000 rupees. They are not banned for life. They don't go to prison. Nothing happens to them. At the same time, we do not have any laws which force them to recall even the batches which are found to be defective or substandard. So if the CDSCO will fairly regularly monitor or pick up samples and test them. And this is not the first time. This is the first time that it has come so much in the papers. But practically every other month, you will read about drugs, samples which have been found to be substandard. Now, when they say substandard, it doesn't say that whether they contain even 0% of the drug that is required. And then there is no further action. I mean, that entire batch doesn't get condemned and recalled. There no manufacturer or, for that matter, marketer of that drug will be told that, okay, if this happens a second time, you will lose your license. It is just, life goes on as normal. Nothing happens.
Right now, this also is associated with a huge economic cost, which low quality and substandard drugs actually attach to themselves. One, of course, is reputational damage that a country like India, which is known as the pharmacy of the world, can not essentially deal with at this stage of our economic growth. What do you think needs to be done to ensure that we can limit this damage now that reports like this keep coming out, and also explain to us what are this attached damage that doesn't stare us in the face, but it's there?
See, the greatest damage that happens internally in our domestic. Let us say even if the 10% of the drugs are not good, they cannot cure your disease. Instead of having a fairly mild fever which goes away in 2 or 3 days of taking paracetamol, you could be laid on your bed for 14 days, 15 days, because the paracetamol itself is false or substand, right? It is much worse if you have got a malarial or a viral attack or any sort of disease which requires a strong antibiotic. You take the antibiotic, you think that it is not working, doctor gets puzzled, he tries something else. You take that too. If you're lucky, that will be working on you, or it might not. So from your point of view, you're spending a lot of unproductive time. You are also, you cannot work. You are spending lots on doctors and on drugs, but they are not curing you. From a company's perspective and from the country's perspective, all these show up in little ways in the productivity lag that we face with other countries. India is known as having low productive workers. Then there is the other danger. The other danger is that suppose you have taken antibiotics for a long time, which are substandard, and they are not working. At some point, you are facing a really serious, antibiotic resistance, which will then make it impossible for even the right doses or stronger doses of antibiotics to work on any disease. So people will develop immunity, and these are all huge problems which are staring us in the face. Then there is, of course, the debt problem. There are so many poor people who need to borrow money, or even middle class, they are hospitalized, their treatment is prolonged, they spend money, they are in debt, they go bankrupt. So these are all things which are huge problems which the government does not seem to pay much attention to. The regulator needs to understand that you could grow faster, your industries could be more efficient, your people could be more productive if only if people got the right drugs at the right time instead of substandard drugs, which don't cure them when they have a fever or a disease of some sort.
Right. So what you're suggesting is that this is a much larger problem that needs to be dealt with head on. Thank you very much, Prosenjit, for joining us.
Yeah, thank you. Thank you.
Well, with that, it is a wrap on the big story. Thank you very much for tuning in, but stay with us on NDTV Profit for more.